and A is incorrectly labeled. What's shown is a plane joint which permits gliding and not a pivot joint which would allow rotation. We'll be spending most of the rest of this module on ball and socket joints because they're the most mobile of the synovial joints, and any motion that occurs at any joint occurs at a ball and socket joint. So examples of ball and socket joints would be the shoulder joint and the hip joint. Ball and socket joints permit motion in all three axes, and the axes will be flexion and extension, abduction and adduction, internal rotation and external rotation. Here is a skeleton, and the skeleton is demonstrating for you flexion at the shoulder joint. Flexion occurs when the angle between the bones meeting at a joint decreases. The angle between them becomes more acute. So this is an example of shoulder flexion. By contrast, extension occurs when the angle between the bones meeting at the joint increases or becomes more obtuse. And here the skeleton is demonstrating shoulder extension for you. At the shoulder, the angles between the bones actually don't seem all that different. It's a little arbitrary at the shoulder. The angulation between the bones is not all that conspicuous. Looking at the skeleton from the anterior aspect, abduction occurs when a limb or limb segment moves away from the body midline, and adduction occurs when a limb or limb segment moves toward the body midline. So abduction away from the midline, adduction toward the midline. Internal rotation occurs when a limb or limb segment turns around the longitudinal axis toward the midline. So in this case, the upper limb is turning around at the shoulder joint so that the hand, instead of facing the palm, instead of facing anteriorly, will now face posteriorly. So internal rotation is occurring at the shoulder joint. External rotation occurs when a limb or limb segment turns around the long axis away from the midline. So in this case, it would be returning to standard anatomical position. So the shoulder joint, an example of a ball and socket joint, allows motion in three axes: flexion and extension, abduction and adduction, internal rotation, and external rotation. A hinge joint permits motion in only one axis. So at a hinge joint like the elbow joint or the knee, the only motions allowed are flexion and extension. Here the skeleton is demonstrating flexion at the elbow. And again, flexion occurs when the angle between the bones meeting at the joint decreases or becomes more acute. Again, extension occurs when the angle between the bones meeting at the joint increases or becomes more obtuse. Flexion and extension are the only motions possible at hinge joints like the elbow and like the knee. So your quiz question is, so based on what you just learned about the shoulder joint, which statement best describes the motion occurring at the hip joint?